Professor Wong, we are very grateful that you accepted our interview request. Given your busy schedule over the past some years, the fitness you have shown is almost unbelievable. What is your secret?
I think there's so much to do. And I find that the people that I meet, I learn so much every time I meet people either I know or I don't know. I find there's always something that I can learn, and it's fascinating.
But do you have any recipes to keep your mental and physical fitness?
Well, I enjoy my sleep. I enjoy my running. I'm just very grateful every day that I'm well enough to enjoy the day.
Okay. Your range of activities is also incredibly broad. Not only do you work as an oncologist, but you are also a consultant in many areas, chair of various professional bodies, and a university lecturer as well. What are you most involved in at the moment?
Currently, I'm most involved in. Well, I see patients for 2 full days. And of course, if they're not well, I will see them in the emergency room or in the hospital. But outside of that, I am spending a lot of time on population health, trying to see how we can keep populations for my country, the people in Singapore, how to try and keep them as well as possible.
In your lecture in Szeged, you also told about longevity and healthy old age. The recipe for a healthy life seems to be very simple. What is the reason why we are not making the most of our potential? What do you think?
Well, firstly, I'm not into longevity per se. I am trying to say we should make the most of the years given to us. So personally, I'm not focusing on increasing lifespan, but I'm saying that if we have been given 80, 90 years, we should really try and make the most of that full 80 to 90 years. But I think it's very difficult as societies because, firstly, there are so many determinants of health. I think many people don't realize that the definition of health, the WHO definition of health, is not just physical well-being, but it's mental and social well-being. So we spend a lot of time looking at physical well-being, blood pressure, cholesterol, have you gone for your checkups? That's your physical well-being. I think in the last 10, maybe 20 years, we're paying more and more attention to mental well-being, which is wonderful. But I think we need to spend as much time looking at social well-being, because you need all these elements of physical, mental, and social well-being. So social well-being, friends, social networks, preventing loneliness, making sure that people are financially secure, making sure that people have meaning and purpose in their life. Is there a reason to get out of bed every morning? Because if there's no reason to get out of bed every morning, physical health will go down and mental health will go down.
This is a very, very complex way of thinking, I think. But as a health professional, we are focusing on the mechanisms that play a role in keeping our life healthy as long as possible. And what do you think is the right strategy to develop medicines that address these mechanisms that can keep us healthy, or to pursue a lifestyle that ensures a long life without the need of medication? What is more important?
Well, I don't think there's one which is more important. I think you need all. So relying just on medicines, tablets or injections, relying on pharmaceutical compounds is definitely not enough. I think a good example perhaps may be COVID. Yes, the vaccinations are very important, but at the height of when there's a lot of transmission, wearing masks are also very important. So you need both pharmacological and non-pharmacological interventions. in terms of health, sleep is so important. Exercise is so important. A healthy diet is so important. Social, having friends, having meaning and purpose, preventing loneliness, and also if you need medication, taking the right dose at the right time, and the right drug. So you need all of these coming together. And I think that is why the first issue, when you asked me why is it so difficult, firstly, there are so many determinants of health. The second is that health is a complex system. So a complex system is where there are multiple variables, and just addressing one variable is not sufficient. You need to try and address as many of them as possible, and very importantly, trying to find the key areas which influence many other areas. So those are probably the three most important concepts. Number one, health has multiple determinants. Number two, health is a complex system. And then three, you need to invest in health across the lifespan. So the man and the woman have to be healthy. If they are healthy, and when they conceive the child, if the mother is healthy during pregnancy, and then when the baby is born, if during infancy, childhood, adolescence, early adulthood, middle age, old age, if we invest in health across that life course, then there's a very good chance that we will have wonderful a lifespan of good health. Now, it doesn't mean that we should give up at any place along the line, because even if we intervene at different stages in life, we can still make things better. So we should invest across the life course, and we should constantly invest during the life course. And that is why we vaccinate 90-year-old people against COVID, because even at 90, you can benefit from vaccinations.
Yeah. And cancer itself is also very complex, problematic.
Yes.
As a society ages, there is a natural increase in the incidence of cancer, which cannot be prevented only by good lifestyle. Cancer treatments are increasingly effective, but increasingly expensive. How do you think we can maintain a health service that gives everyone a chance for recovery?
So firstly, many cancers are preventable. So we do know that we must not smoke. We do know we should try and take as little alcohol as possible. We do know that we should try and maintain ideal body weight. So in terms of common preventable causes of cancer, smoking, alcohol, being overweight. These three things are so important in trying to prevent cancer. And then regular exercise, eating vegetables. So eating vegetables, these are all very important in trying to reduce the risk of cancer, trying to cut down on the amount of preservatives in food, and then going for what we call age-appropriate screening. We do know that breast cancer, if you go for screening at the recommended ages, we do know for colon cancer, cervical cancer, for these cancers, if you do go for age-appropriate screening, we can either catch cancer in the precancerous stage, which is the ideal. You catch it in the precancerous stage, and then simple surgery can prevent it from progressing. If people are so unfortunate to come down with cancer, catching it as early as possible so that you don't need drugs. And then if you do need drugs, again, you try and catch it so early so you need as little drugs as possible. Yes, because cancer treatments are expensive. And so the whole goal is to try and see how to avoid this as much as possible. But for the cancer treatments which are proven to increase cure rates, I think governments around the world are trying to find the resources, to pay for this. And I think there's constant, the pharmaceutical industry needs to recover the investments they've made in developing cancer drugs. But I think that there are multiple things that we have to do to try and make sure that cancer treatment remains affordable. But we can't expect that cancer drugs is going to save everything. We need to try and do everything to prevent the development of cancer, and again, try and diagnose it early, try and treat it early, and so on.
I heard a conversation with you in which it became clear that as a doctor you think that it is important for the doctor to see the patient as a partner in healing. Okay. How prevalent is this approach in Singapore?
We try and make it as prevalent as possible. I think one of the big challenges, to become a partner takes time. I think that's one of our most challenged assets, is to find time to develop. I mean, it's quite, to me, it's always remarkable that that a total stranger will allow another stranger to ask the most intimate questions, to examine them, to either operate on them or administer drugs with significant potential side effects. It all requires tremendous trust. And trust takes time, and I think that's what we need to do. We need to invest in the time in developing that relationship. And it's so important that the most important person in the whole discussion is the patient and the family. I mean, the patient and the family have to want treatment, then they have to understand what the treatment involves, and then very often there are going to be trade-offs in treatments. And certainly cost is an issue, but side effects are an issue. And then the patient's goals. You know, what are the patient's goals, especially if they have a very serious, potentially incurable disease? What are the patient's goals? And all of this requires a clear understanding. What can the doctor do, and very importantly, what the doctor cannot do. And I think really trying to understand and develop that plan. And the plan is not fixed once it's, the plan evolves, like everything evolves, but it's all about the relationship, and that takes time.
Thank you. You spent most of your research years in Singapore and the US, working with researchers from all over the world. Are there skills and attitudes that differ between researchers of different nationalities? And if so, what can we learn from each other?
Okay, so firstly, I don't think that there are skills which, well, okay, let me take one step back. I think all cultures, all communities are so rich in knowledge and experience. I think that when it comes to being really meticulous, I'm just amazed at the discipline of Japanese and the Koreans in being so meticulous and so detail oriented. It's quite amazing. I think that, but when it comes to sharing of knowledge and curiosity, the American culture, but it's not just, America is a huge melting pot. There are people from Europe, there are people from Africa, there are people from Asia, there are people from the Middle East, from Latin America. It's a great melting pot, and in America, the curiosity and the concept that there's no limits, anything is possible. It's refreshing. Now, these are all generalities, but I think that every time I'm meeting with people from multiple different countries and cultures, there's always something rich and worth learning.
Given this experience, what do you think about the program of this academy that supports young students to be researchers?
So, I think Hungary, I've always wanted to come to Hungary. I've had this when I was growing up, one of my heroes when I was, I think I was 12, 13, was Ignaz Semmelweis. You know, I read his story and it was so powerful. You know, Hungary has a tremendous. You've got centuries of heritage in culture, in the arts, and in the sciences. So you've got very strong DNA in science, in the arts, and you know, one thing, you've got such a beautiful country, but one very exciting feeling that I've appreciated since I've arrived is the sense of optimism. There's a sense of optimism in Hungary when I speak to people in restaurants and universities, and when we were visiting the schools. That's very, very refreshing. And the fact that you are investing so much in inspiring school students, that's key. That's key. I mean, we were all high school students. We should also remain students. I think we should all remember and try and remain students as much as we can, because when you're a student, it's like being a sponge. I remember, you know, one of the best things about being a student is that your responsibilities are just to learn. And that's an incredible feeling. And the fact that you have got such great people from Hungary, and then you invite people from around the world to interact with your students, I think that's, you should invest even more. What you're doing now is wonderful. I think you should invest even more in this, you know, in programs like this, because your return on your investment, not just in terms of economic capital, but just in terms of human capital, so that people understand that there are different ways of approaching a problem. That's priceless. And then the social networking amongst the students, that's also priceless, because you never know where life is going to take you. And the networks and friendships that you build can benefit in years to come. So the capital that you are building through this program, human capital, social capital, and potential economic capital, this is a great investment. And I really think that every country should have programs like this, and I think that you should invest as much as you can afford it. And our people are the most important asset. More priceless than gold, more priceless than oil, are people.
Thank you. Professor Wong, it was an honor to speak with you, and I hope that we can meet each other soon in Hungary.
Yes, thank you. Or in Singapore. You must come and visit us in Singapore. Thank you very much. Thank you. Thank you.